Welcome to Frederick at its best. I'm Frederick County Executive Jan Gardner. March is Colorectal Cancer Awareness Month. Colorectal cancer and other cancers affect everyone. They affect people in your family. It could be your mother, your sister, your aunt, your grandmother, a friend, an office colleague, or your next door neighbor or a childhood friend. Cancer is no respecter of persons or even gender. We all know someone, unfortunately, who has had cancer. Colorectal cancer is the fourth most common cancer in the United States and the second leading cause of death from cancer. Colorectal cancer affects people in all racial and ethnic groups, and it's most often found in people age 50 and older, even though I will say I read a recent article in the news that said they're starting to see colorectal cancer in people of younger age. So this is information for everyone. But there is good news. If everyone age 50 and older was screened regularly, 6 out of 10 deaths from colorectal cancer could be prevented. When adults get screened for colorectal cancer, it can be detected early at a stage where treatment is most likely to be successful, and in some cases it can even be prevented through detection and the removal of precancerous polyps. 1 in 3 adults over the age of 50 are not getting tested as recommended, and that's about 23 million people. Early-stage colorectal cancer typically does not have any symptoms, which is why screening is absolutely necessary to detect this cancer early. There are a variety of symptoms of colorectal cancer, and I'll certainly let our representatives from the health department and other agencies discuss what they are and to share more about their cancer education program. I would like to mention, however, that if people would modify their lifestyles, they could reduce their risk of getting colorectal cancer as well as other kinds of cancer. And all of us can use this advice. For instance, losing weight, increasing physical activity, stop smoking, reduce your consumption of red or processed meat, cut back on alcohol consumption, eat more fruits and vegetables, and help you live a healthier, longer life. And those pieces of advice are good for all kinds of health issues. Cancer prevention starts with healthy habits. There is something we can all do in this battle of colorectal cancer and other cancers. Colorectal Cancer Awareness Month is a good time to learn more about how to prevent and detect cancer and learn about the resources that are available in our community. The Frederick County Community Cancer Coalition recently signed the pledge for the 80% by 2018 initiative, which is sponsored by the National Colorectal Cancer Roundtable Initiative. More than 140 organizations have committed to eliminate colorectal cancer as a major public health problem and are working toward the shared goal of 80% of adults age 50 and older being regularly screened and tested for colorectal cancer by 2018. Currently, our screening rate in Frederick County is about 70%, so we still have some work to do. If, as a nation, we can achieve 80% of the population getting screened for colorectal cancer by 2018, there will be 277,000 fewer people diagnosed with colorectal cancer, and over 200,000 lives will be saved. We can all do our part in this awareness campaign. I encourage you to go home, talk to your family, your friends, people in your community about the importance of getting screened for colorectal cancer starting at the age of 50. And now I'll read the proclamation before I introduce all the people who have joined me here today. Whereas colorectal cancer is the second leading cause of cancer deaths in Maryland and the fourth leading cause of cancer death in Frederick County. The American Cancer Society estimates 2,430 new cases and 860 deaths will occur in Maryland in 2017 due to colorectal cancer. And whereas screening is the best method of early detection and prevention of colorectal cancer, and whereas individuals over the age of 50 and those under 50 years with personal or family risk factors should be screened, and whereas the Frederick County Health Department and the Maryland Department of Health and Mental Hygiene urge healthcare providers to recommend colorectal screenings for their patients and urges the public to seek screenings. Now, therefore, as the County Executive of Frederick County, Maryland, I hereby proclaim the month of March 2017 as Colorectal Cancer Awareness Month in Frederick County, and do commend this observance to all of our citizens. And of course, you can best observe this month and this proclamation by making sure that you yourself, if you're age 50 or older, are screened, or the people that you know who are age 50 or older, talk to their doctor about proper screening and prevention. So with that, I'm going to pass the microphone so you can introduce yourself and add what you'd like to say. So we'll start with you.
I'm Gail Bowerman, and I think that the most important message that goes with this is that screening saves lives. And that's the message we want to get across to everybody. Don't delay, don't put it off. Whether you do it through the health department services or with your own private physician, just do it.
Good morning, I'm Beth Mowry, and I'm the program administrator of our cancer screening programs at the Frederick County Health Department. I want to thank County Executive Jan Gardner for having us here this morning and giving us the opportunity to talk about the importance of being screened. If we have any residents out there that are uninsured or underinsured, I encourage you to call our program to see if we can be of assistance to you. I think later in the program we're going to be posting our phone number and our website, but our program is here to help, and I encourage you to call us. Thank you.
Hi, I'm Avnisha. I'm an outreach coordinator at the health department. I would just like to say that don't delay. Just take control of your health and get it screened. Screening is the early detection for cancer. Thank you.
My name is Graciela Vilasis. I represent the Asian American Center of Frederick. I am a community health worker also. The more important is our vision is to see everybody healthy, eat healthy too. Please don't forget, if you need some questions, just stop by in our organization. I can help you with all information we have. Thank you.
Hi, good morning. My name is Susie Ford, and I'm with the American Cancer Society. And first and foremost, we just wanted to thank you so much for the proclamation for this month of March. We are extremely appreciative of the signing of the 80% by 2018 colorectal screening pledge. This truly does mean a tremendous amount of support. As mentioned earlier, there will be over 200,000 lives saved by 2030 if we do abide by the screening guidelines. Currently here in Frederick, we're at about a 70% when it comes to our screening initiative outreach, but by achieving the 80% by 2018, we will be able to overcome those low screening rates. So thank you so very much about getting this important message out.
Good morning. I'm Laurie Fry. I'm also with the American Cancer Society. And I think one of the obstacles that we hit a lot of times with getting people to be screened is related to the prep. Well, I will raise my hand. I have had my screenings twice, and the prep is really not that bad, so don't be afraid of it. Please go see your doctor, do what you need to, and if you have a really good screening, you have 10 years before you have to have it again. So thank you.
Good morning. I'm Nancy Boyd, and I'm wearing 4 applicable hats for this event. I am a 17-year survivor of another type of cancer. I am a longtime American Cancer Society volunteer. I'm with the Maternal Child Health Division at the Frederick County Health Department, and I'm the nurse educator at the Asian American Center of Frederick and supervising the community health workers. Our community health workers are going to be working in the community with individuals who have not really been taking care of their health, and they're going to be encouraging them and hooking them up with resources.
Thank you so much. My name is Jessica Dayal. I'm the health program specialist, excuse me, at Asian American Center. And I wanted to just give some statistics. I came from a meeting. Last year alone in the US, 8% of men and 8% of women died from colorectal cancer. So I do want to express this urgency to get screened for all of our community members. And even if you think that you are not at risk, it's better to just get just get the screening done. And as an Asian American, I also want to let the Asian Americans know that colorectal cancer is actually one of our top cancer sites, and it's quite important for us to go get screened, especially over 50. So thank you so much.
I want to thank all of you for joining me today to help increase and raise awareness about colorectal cancer. We want the public, if they need more information, to either contact the Frederick County Health Department or they can contact the American Cancer Society. There are ways, if you don't have insurance or you're underinsured, to get assistance to make sure that you can get your screening. We hope that we can all continue to work together as a community through research and advocacy to find a cure for cancer, for colorectal cancer and all kinds of cancers. So I want to commend everybody who works to try to raise money for research and those who do that research. We certainly want people to live a long, healthy, productive life in Frederick County. So thank you for joining us today for Frederick at its best. These people are all here to help make sure our community stays healthy and ensures a bright future. Thank you for joining us.